Thanks, Rodney. Well, right now, in an emergency, tens of thousands of people have to rely on hospitals, sometimes hours from their homes, a delay that can be life-threatening. Rural hospitals are closing at an alarming rate. Nearly 90 have closed nationwide in the last 10 years. And southern states, including Alabama and Tennessee, are some of the hardest hit.
Well, I'd hate to be doing something somewhere or go to a hospital somewhere.
Bobby Campbell's wife, Margie, is fighting off an infection. She's in the caring hands of doctors and nurses at this hospital in rural Lincoln County, Tennessee. Thankfully, it's just a few miles from their home. But if it closed, as dozens of rural hospitals have, the next closest one is in Huntsville, nearly an hour away.
Yeah, that's a long ways, right.
In Alabama, where 55 of our 67 counties are considered rural, 6 hospitals have shut their doors in less than 10 years, leaving thousands without health care choices close to home. In Tennessee, 8 hospitals have closed.
Your hospital is your last line of defense.
Candy Starr is the CEO of Lincoln Health System. She says when a rural hospital closes, the effects are devastating, and not just on patient care. The economic impact spreads like a cancer through the community.
Those jobs are gone, and it's really hard to attract and maintain any industry and businesses in these communities, and therefore it just creates a vicious cycle of joblessness and economies that are not going in the right direction.
Hospitals that are open are operating on life support. 86% of Alabama's rural hospitals operate in the red, according to the Alabama Hospital Association.
And there comes a time where you just have to say we have to do something drastically different.
Here in Fayetteville, Tennessee, Lincoln Health System was facing some very tough decisions. The folks who live in the small surrounding communities at real risk of losing their hospital. But they found a white knight in Huntsville, Alabama. Last month, Lincoln signed a deal with Huntsville Hospital System, giving it more financial stability, essentially ensuring its survival. It's a partnership, one that Lincoln Health System says will help provide more cost-effective, quality care.
You know, our patients, when it comes to patient care, we don't see a state line.
Some communities have raised taxes to shore up their local hospitals. And Starr says there is another way to resuscitate failing rural hospitals, but it's a bitter pill that's become a political hot button.
Funding a Medicaid expansion is just one tool that I think all smaller rural community hospitals are going to have to look at.
Alabama and Tennessee are among 14 states that did not opt in to Medicaid expansion as part of the Affordable Care Act. Proponents say it would provide billions of dollars to help keep rural hospitals afloat, but opponents point to copay estimates of $200 to $300 million. Governor Kay Ivey said recently Medicaid expansion was, quote, not an issue we can tackle at this point. Her opponent, Democrat Walt Maddox, has said Medicaid expansion would happen on day one of his administration, although he has not come up with a clear plan to pay for it.
There's a fine line there with trying to fund that, but it does immediately give some improvement in that folks have access.
The Alabama Hospital Association is pushing for expansion, saying rural hospitals employ more than 11,000 Alabamians and generate more than $500 million in annual payroll benefits. Beyond the dollars and cents, Starr says lives are at stake when a rural hospital closes.
Time is heart muscle if you're having a heart attack. Time is brain tissue if you're having a stroke.
And that's what's most important to patients like Bobby Campbell and his wife. They aren't thinking about the cost of running this hospital or the political tug-of-war happening in Montgomery. They're just thankful it's here when they needed it.
This is a good hospital right here and a good service that they're giving.
Another cost-saving trend is the concept of micro-hospitals, basically local emergency rooms with just a few beds to treat and stabilize patients before sending them on to a larger facility. Hospital administrators say that brings these smaller rural hospitals really back to their original intention.